Okay, let's dive right into this. For years, we've been hearing about this massive crisis in healthcare, right? It's usually framed as a purely personal problem, physician burnout. But in today's explainer, we're going to look at the hard data and the research to reveal a much deeper, kind of shocking truth. Our core thesis today: what we've been calling burnout is actually a systemic crisis. It is absolutely not a personal failing. We're talking about a structural flaw in modern medicine that's literally costing billions of dollars, driving incredible healers away from the bedside, and fundamentally altering how care is delivered to all of us. To really understand this crisis, we've set up a clear roadmap for this explainer. Think of it as our diagnosis and treatment plan. First, we'll look at the true cost of burnout. Then we'll ask, is it burnout or moral injury? Next, we'll explore death by 1,000 clicks. After that, tomorrow's physicians. Then the systems level prescription. And finally, the verdict. All right, let's get started with Section 1, the true cost of burnout, looking closely at the financial and human symptoms. Before we can even try to diagnose the root cause here, we really need to look at the staggering symptoms hitting the healthcare system right now. And let's start with the bottom line: $4.6 billion. According to a comprehensive Harvard study led by researcher Joel Gaw, that massive number is the estimated annual cost of doctor burnout to the U.S. healthcare system. It immediately validates that, hey, we're not just talking about some soft issue regarding workplace happiness. This is a massive, absolutely critical problem for the business, the administration, and the overall sustainability of healthcare. So where is that $4.6 billion coming from? It's not just thin air. It stems directly from physicians reducing their clinical hours just to cope, incredibly high turnover rates, and the giant administrative expenses needed to find and hire replacements. When you break the whole shebang down, it costs the system roughly $7,600 per doctor every single year. But here is the absolutely crucial takeaway. The Harvard researchers emphasize that this is a very conservative underestimate. Why? Because it completely ignores downstream effects. We're talking increased medical errors, malpractice lawsuits, and patient dissatisfaction. The true cost? Oh, it's likely much, much higher. Moving on to Section 2, burnout or moral injury, uncovering the underlying disease. Drawing from some brilliant insights by Dr. Charles Yeo over at Jefferson Health, we really need a major paradigm shift here. We have to rethink our vocabulary. On the left side, we have the traditional term we all know, burnout. Now, the problem with this word is that it subtly implies a failure of the individual, right? It suggests the lack of personal resilience or grit or resourcefulness. But come on, doctors are literally some of the most resilient, gritty people in our society. On the right, we have a much more accurate diagnosis: moral injury. This completely reframes the issue as a systemic failure. It's a system where healthcare workers are forced to constantly navigate a complex, tangled web of conflicted allegiances, torn between what the patient actually needs and what insurers, employers, and regulations demand. We seriously need to stop thinking doctors just need, more yoga or wellness modules and start seeing this as a deeply broken system. Now, you might be wondering, where does that term even come from? Moral injury actually originates in the language of war. It was used to describe a deep soul wound that pierces a soldier's fundamental sense of morality. Translated to medicine, the definition is being unable to consistently and without excessive burden provide high-quality care, preventative health, and healing in the context of contemporary U.S. healthcare. It is exactly what happens when excessive regulation and endless administrative burdens totally strip the autonomy away from our healers. Which brings us to Section 3, Death by 1,000 Clicks, the Tech versus Human Battle. Let's look at some really stark data from a study published in the Journal of Medical Internet Research. It reveals a very clear culprit for this moral injury. Of the mental health physicians and learners experiencing symptoms of burnout, a whopping 74.5% pointed the finger directly at electronic health records, or EHRs. Think about that for a second. Nearly 3/4 of the affected workforce are explicitly linking their exhaustion to the exact technology that was supposed to make their jobs easier. Crazy, right? And we can totally humanize that data with this incredibly visceral quote directly from participant 94 in that same survey. They just said, "Death by 1,000 clicks." Wow. It's such a powerful phrase, isn't it? The research clearly shows that non-intuitive, clunky interfaces, endless checkboxes, and really poor workflow integration are robbing doctors of what actually matters: quality, face-to-face time with their patients. The technology has basically become a giant brick wall rather than a bridge. But here's where it gets truly fascinating. The researchers didn't just survey these doctors. They actually went in and looked at the back-end computer logs. and they found a massive reality gap. The cognitive load and pure frustration of using these EHRs is so incredibly heavy that doctors drastically overestimate the actual time they spend clicking through them. They felt like they were spending 13.6 minutes more per patient on the computer than they actually were. And they overestimate their after-hours EHR work, what they call pajama time, by over 5.5 hours a week. The software is so draining, it literally distorts their perception of time. Just let that sink in. All right, Section 4, Tomorrow's Physicians. Let's look at the toll on trainees. Today's trainees are essentially inheriting this morally injured system, but the good news is they're fighting back. Take a look at this. This is the General Surgery Residency Survival Guide, edited by folks like Dr. Alec Beakley and Dr. Mark Neff. What's amazing is that it features chapters written entirely by surgical residents. It's brilliant evidence of how today's trainees are actively collaborating. They're creating these grassroots efforts from the ground up to protect their well-being, manage those notoriously grueling hours, and navigate the super complex realities of modern surgical training together. And you know what? That collaboration starts even earlier, right in medical school. In Training is another really powerful trainee-led initiative. It was founded by medical students Ajay Maja and Alina Paul. This book collects 102 peer-edited narratives, giving a real voice to the humanism and the incredible resilience of young doctors as they transition to the hospital wards. They're openly writing about confronting burnout, reflecting deeply on the patient-physician relationship, and identifying these huge systemic barriers to care before they've even graduated. It's really inspiring stuff. But despite all these incredible grassroots efforts, the systemic weight is just crushing. The National Academy of Medicine reports this absolutely alarming statistic. Between 45 and 60% of medical students and residents are already experiencing substantial burnout symptoms. Let me repeat that. Up to 60%. We are quite literally burning out our future healers before their careers have truly even begun. There's no way that's sustainable. So, how do we fix this? That brings us to Section 5, the systems-level prescription, the expert treatment plan. To actually cure this systemic disease, rather than just putting a Band-Aid on the symptoms, we need a really comprehensive approach. Now, what's really interesting about this slide is how the National Academy of Medicine's systems model has comprehensively mapped out the entire care team's environment. You can see here that clinician burnout and professional well-being are actually the outcomes of a massive structural funnel. It starts way up top with the external environment, filters down to the healthcare organization itself, then to frontline care delivery, and finally, bam, hitting the individual. A real cure has to address all of these concentric circles. Right at the center of that model is the core imbalance that is driving this entire crisis: job demands versus job resources. As you can clearly see, right now, the scale is tipped completely to the left. Excessive workloads, massive administrative burdens, and that clunky technology we talked about are heavily outweighing the resources on the right. Things like autonomy, rewards, meaning in work, and professional support. It's basic physics, right? To cure moral injury, organizations absolutely must rebalance these scales. To achieve that critical balance, the National Academy of Medicine lays out 6 very clear policy goals. Ready? Number 1, create positive, high-functioning work environments. Number 2, do the exact same thing for learning environments to protect our trainees. Number 3, actively reduce the administrative and regulatory burden that constantly distracts from actual patient care. Number 4, enable technology solutions. This means health IT must actually support clinicians, not hinder them. Number 5, provide stigma-free support services for clinicians to recover. And finally, number 6, invest in dedicated research to continually measure and improve professional well-being. Guys, this right here is the definitive blueprint for redesigning our clinical systems. And finally, Section 6, the verdict, a provocative conclusion. So what does this all mean, and why should this matter to you? Well, because a morally injured, administratively burdened, exhausted doctor ultimately leads to lower quality care, a higher chance of medical errors, and a super fragmented healthcare experience for you and your family. Make no mistake, their working environment is your healing environment. So the absolute crucial question we are left with today is this: will we finally commit to fixing the broken system, redesigning the technology, and removing all that administrative bloat, or will we just keep blaming the healers, telling them to be more resilient while the system slowly burns them out? The diagnosis has been made, the treatment plan is crystal clear. Now it's just up to our institutions to actually take the medicine. Thank you so much for joining me for this explainer. I really hope this leaves you with a totally new perspective on the realities of modern medicine.